Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew County and District Health Unit. Today, I was hoping to have some really good news for you all about vaccinations and the progress we've made. But unfortunately, this video is not going to be positive. We have a major concern, which we've noticed this past week in the Arnprior and the McNabb-Braeside region. In fact, we have 14 cases that have tested positive and a number of other contacts that we're still looking at. And I think today, in fact, was the worst day since we started this last March for the Renfrew County and District Health Unit. Now, many of these cases, as you can see from the infographic, attended the same social gathering. And then they went to 4 different households and to 7 different businesses and workplaces. And in fact, some of these businesses, workplaces have been shut down. And after that, 1 or 2 of them went on to an additional private social gathering and spread the disease even further. Now, I'm very concerned about this because clearly people aren't paying attention to their social network. We've told everybody that it's so important to hand wash, to wear a mask, and to distance. But the key is traveling and keeping your network very small, confined to your household or to your workplace, and in particular at your workplace, to make sure that you don't let down your guard during lunchtime, during your free time. But having a carefree party, outdoor activity, and later indoor activity during this time, during this winter, is just not on. It's flagrant and wanton disregard for the public health measures, which are so important to keep us, our families, our loved ones, and our community safe. Furthermore, Renfrew County was one of the first, county and district was one of the first areas to go back into the green. And this is going to jeopardize that, very possibly. But why should all of Renfrew County and district suffer if it's confined predominantly to the Arnprior area? I mean, we in fact could levy stricter restrictions on just that area. Why should the rest of the county suffer? This is very important. As I said, I'm very concerned about this last event because it's flagrant disregard and disrespect for what we're trying to do. Now, I've said time and time again that the public is the offense here in terms of keeping the virus at bay. Hand washing, masking, distancing, but most important of all is keeping your network very small, confined to your household or your immediate colleagues at work, not to let down your guard and to avoid travel. On another note, we have very good news. The vaccines are starting to roll. As I speak, we're doing staff at long-term care homes and the families that provide the essential care. And a few days from now, we'll be doing the second dose of the vaccine for the long-term care residents. And from there, we go on with the priority list for healthcare workers that are at immediate risk. And soon, we will be vaccinating our most senior folks in Renfrew County and District. So this is good news. But in the meantime, and it's still winter, we need to really behave. We need to be extremely careful. I've talked to the mayor and I'm talking to local municipal politicians. We will be doing this time and time again whenever we see problems. Before it was the Barry's Bay area and region. Now it's the Arnprior McNabb Braeside area. We will be talking to them because it's very important that local politicians, the municipalities know what's going on. And you, the public, are the eyes and ears on the ground. We're a very small health unit. We can't be everywhere. We're stretched to capacity with COVID. And it's up to you. If you have problems, if you see egregious misbehaviors, let your municipality know. And they can do something about it, but also they can tell us and we can arrive and ticket as needed. So there you go. As I said, vaccines are coming, but we need to really concentrate on what needs to be done. And that's the right behavior, specifically the size of our social groupings. Thank you.